Hello there, welcome to another Upgrade Your OET Vocabulary Quiz by Bose Learning. My name's Sona and I'm a premium preparation provider of the OET from Bose Learning. Today's quiz is all about ringworm, and we have a bit of a special for you because we've also got an OET speaking subtest to have a look at and analyse together. So, what about my questions for you today then? First of all, what is ringworm? Number 2, how do you get it? 3, how can you treat it? And 4, what advice can you give to a patient who's got it? This is a special because we will be looking at an OET speaking subtest role-play card that we can analyse together. Okay, do you know the answers to my questions? First of all, what is it? As ever, just to let you know, I am not a healthcare professional, I'm an English teacher. Therefore, all my medical information comes from the NHS website, and this time it's the information all about ringworm. What we're going to do is look through the information because it's presented in a nice patient-friendly manner, and that's what you need to be able to do in your role plays. So we're going to look at some vocabulary and pronunciation as well as the advice that's given. So ringworm then is a common fungal infection and it's not actually caused by worms at all. That's a misconception. So my little picture of a worm at the start of the quiz was a red herring. You can usually buy medicine from a pharmacy to treat it. So it's not something a patient would normally come to see a doctor about unless it's serious. How can you check if it's ringworm? Well, the main symptom is a rash. It may look red, silver or darker than the surrounding skin depending on your skin tone. And this rash may be scaly, dry, swollen or itchy. It can appear anywhere on the body, including the scalp, that's the top of your head, underneath your hair or your groin. What does this word scaly here mean? Scaly. Well, scaly skin is so dry that small pieces of it fall off, a little bit like a fish perhaps. So that's the idea of scaly, and it's an A sound, scaly. How do you get it? Well, here's some information about how it's passed on. It's caused by a type of fungi, and it can be passed on through close contact with an infected person or animal, infected objects such as bedsheets, combs or towels, this B here is silent, combs, or even infected soil, although this is less common. In terms of vocabulary, you can see a very nice phrasal verb here, passed on, which means to transmit or give someone an illness. Now I have a little question for you. Can this phrasal verb be separated? So can you put the object in between the pass and the on? What do you think? We can say ringworm can be passed on. So the infection can be passed on. And actually we can also put the object in the middle. Be careful not to pass it on. So you can pass something on, or something passively can be passed on. So that's 2 ways to use this phrasal verb pass on, which means transmit. Okay, back to our questions then. Number 3, how do you treat it? So a pharmacist can help with ringworm, and that's who you should speak to first. The pharmacist will look at the rash and recommend the best antifungal medicine, which could be in the form of a cream, a gel or a spray, depending on where the rash is. You may need to use the medicine every day for up to 4 weeks, and this is the important bit. You have to use the right amount for the right amount of time, even if the rash has gone away. A pharmacist will tell you if they think you should see a GP. A pharmacist is another word for a chemist. Here in the UK, we use the two interchangeably. And finally, what advice can you give to a patient? Well, of course, start the treatment as soon as possible. Wash linen so that's towels, bed sheets, etc. regularly. Keep your skin clean and wash your hands after touching animals or soil. Regularly check your skin if you've been in contact with an infected person or animal, and take your pet to the vet if they might have ringworm, and this can be told in case they have patches of missing fur, for example. Don't share your combs, your towels, your bed sheets with anyone else who has ringworm, and importantly, don't scratch, because if you do scratch the rash, this can spread it to the other parts of your body. Some vocabulary to look at here. Fur. So that's hair on an animal. Fur. This sound here is an sound. Okay then, so we have our speaking practice role play card coming up, but before we have a look at that, I want to remind you to please click like if you like this little video and these quizzes, share it with a friend or a colleague who you think might like it, and subscribe to us so that you won't miss a single quiz. Okay then, back to the role play card then. What we're going to do is take a look at a typical OET role play all about ringworm and look at the things you should be doing in your 3 minutes preparation time. After that, we'll look at some phrases that you can use. So here we go. This is a speaking practice card. First of all, look at the setting. In this case, you're a nurse who's working at a school. And your 16-year-old patient has recently commenced antibiotics for a chest infection. A rash has appeared on their scalp. Do you remember scalp? That's that part of your head underneath your hair. They are worried that they are having an allergic reaction to these antibiotics. You'll also get a task which will give you a list of things that you need to do during your 5 minutes speaking the role play. What you'll notice is that each of these start with a command. So in your 3 minutes preparation time, read all of this carefully, pay attention to these words, and then think about some useful language that you can use. Your 3 minutes preparation time starts now. Okay, how did you go then? What did you pick out in your 3 minutes? So, if it's me, one of the things I'll be thinking about is my patient, of course. Now, my patient is 16. In the UK, that's when we normally have exams, so they might be stressed and they're at a school. We know that normally if you have ringworm, the advice is to go and see the pharmacist directly, but obviously this patient is at school, the nurse is there and available to talk to them, so they've come in to see the nurse with their concerns. So think about how your patient might be feeling. What does a normal 16-year-old feel like when they have exams, they're at school, they've just had a chest infection, so they've been a little bit poorly anyway, they're on antibiotics, and they're obviously uncomfortable. If they have a rash on their scalp, they might be worried. Of course, it says that here, but they might also be embarrassed. I don't think many 16-year-olds or anyone actually of any age would like a rash on their scalp. So the next thing then is to really focus in on the task itself. And we're going to be looking at all of these, so let's look at it together. Reassure the patient that the rash is not an allergic reaction. So we need to tell the patient not to worry. So I would start by thinking, how can I do that? Explain to them that they have none of the common signs of an allergic reaction. So obviously, your patient's going to be worried about this. Maybe they'll be a little bit insistent about this, and this is why this point comes up twice. First, we have to reassure them, don't worry. Then you have to explain why. So maybe at first they're not convinced. So in this test, you have to be a little bit of a detective and try and pick up on clues in your 3 minutes and get yourself ready for what the patient might say to you. You then have to advise the patient about continuing with the course of antibiotics. So it really looks like the patient doesn't think it's ringworm, they think it's an allergic reaction and they want to stop. Of course, we all know that stopping antibiotics midway through a course is very dangerous, so we need to tell them about that. Then we need to give them advice about how to treat the actual ringworm problem. And they tell you some information here, and then also find out who they live with. Why? Because we know that there's cross-contamination possible, so the patient has to be careful. Okay, let's look at some vocabulary to help you do all these things in bold. So first of all, how can you reassure the patient? Well, you could say something like, don't worry, I know that you're worried it might be an allergic reaction, but I'm sure it's not. So you're reassuring the patient not to worry, you're empathizing that you understand what their concern is, but actually it's nothing like what they think. How can you explain that they have none of the common signs of an allergic reaction? Something simple like this is because normally when someone has an anaphylactic shock, the symptoms are very severe, breathlessness, etc. So introduce it with a nice phrase like, this is because. Advising the patient. What I'd like you to do is carry on with the antibiotics. Now, we know this is important, so stress that, emphasize it to your patient. It's very important that you keep taking them, because if you don't, etc., etc. Now, giving them advice. Tell them that you've changed, you're moving on from the antibiotics information, and you're talking now about treatment. So signal this. In terms of treating the ringworm, what you need is, and then you give them the advice, and it should clear up in 2 to 4 weeks. Remember, another thing you're looking for is anything too formal or too medical that you need to change. Resolves itself is fairly formal, it's fairly medical, it's not something you'd use with a patient typically. Instead, a nice phrasal verb, clear up. And then finally, find out who they live with. It might be a bit embarrassing. They might live with lots of siblings. So be prepared, acknowledge that it might be embarrassing, and prepare the patient. Can I ask who else lives in your house? We'll need to let them know because, etc., etc. So here are some nice sentence stems for you. I hope you liked them and found them useful. This is a little preview from our forthcoming on-demand course for nurses. We've already got one out for doctors, and I'm working on the nurses one as we speak. You'll find the links to all of these in the comments box below. And also, if you want the full role play and the patient card, I'll put a link on to how you can download that as well, so you can practice with a friend of yours. Don't forget to like, share and subscribe to us if you enjoy these little quizzes and find them useful. Feel free to drop us a line and give us a little comment in the comments box as well. We always love to hear from you. And here's some more information about those on-demand courses that I told you about. As I said, you'll find all of the links in the comments box below. Thanks again for watching. Why not watch another quiz with us or see you again next time? Take care. Bye-bye.